Okay, we're on. This is ThinkTech. You're listening to ThinkTech Hawaii broadcasting on Ustream and on Spreaker. Ustream for video, live streaming video, and Spreaker for live streaming radio. Wow, to the world, okay? P.S. We're incorporating translations in our videos, and we'll do them again and again, but with various translations. You like Korean, Japanese, the new Chinese? We got it. That's ThinkTech, changing, evolving, transforming, to use that word every day. Anyway, Matt Delaney, thank you for coming on the show.
Thank you for inviting us.
Absolutely. And Tony Malone, you guys are both from, let's see, High Group or Hawaii Group?
Yep, Hawaii Group, and Hawaii Group owns various companies, including Hawaii Human Resources, also known as HIHR.
Okay. Well, you guys are right in the middle of what's going on with healthcare. And the title of our show today is Healthcare in Hawaii. It's kind of the same name that we used 2 weeks ago on June 27th for our ThinkTech Hawaii Venture Capital program at the Plaza Club. It was a lunch and panel program featuring a number of your colleagues and peers, all talking about healthcare in Hawaii. So we wanted to revisit, because we never really finished all the Q&A. We had tons of them left over. I wanted to at least try to answer a few, and we'll have a series of programs actually trying to answer a few of those questions. So Matt, you were a speaker in that program on June 27th. Tell us about your experience. What did you think, of the way it came together intellectually?
It was an honor to be part of the panel, and the group that you had up there was just fascinating. I always like to learn something new every day, in which I did that day for sure. It was a good representation of the insurance world, the hospital provider world, the doctor profession, the state and the federal insurance commission. So it was really well-rounded, and I think you had a great guest out in the audience that raised some really tough questions that I think we did our best to answer, and today we'll try and answer the ones that didn't get answered that day.
Well, let me review who was there. The woman who was really, the primary interface for me anyway was Ginny Pressler, Executive Vice President of Hawaii Pacific Health, Kapilani Hospital, Polymomia Hospital, Straub Hospital and Clinic, the biggest health provider in the state, actually. See how Topsy grows. You look once, you look again, and it's twice the size. Anyway, she was there as our moderator, and she really helped me put the panel together. We had Tom Matsuda, which I thought that was a very important person to have there. He's the implementation manager of the Affordable Care Act at the Office of the Governor. It's one of those special jobs, it's a special project job. If you ever get offered a job like that, Tony, don't take it.
Don't take it?
Stay
okay.
with the Hawaii Group. You'll be happier.
Definitely.
A lot of pressure on Tom's shoulders, that's for sure.
Yeah. Anyway, he's very good. I mean, he sees it at the 50,000-foot level. I enjoyed his remarks. Gordon Ito, solid guy, the insurance commissioner of the state of Hawaii and within DCCA, also a very valuable player. Happy to have him on the panel. Hilton Raythiel, he was on a previous panel we did on the same subject right after the ACA was passed. And again, Ginny Pressler put it together for us. And Hilton was equally good. He's quite a guy. If you see HMSA as speaking through him, as him the voice, the agent of HMSA, it's a pretty good company actually. His word was well. Do you remember?
Yes, well.
Well. Everybody had to pick a word.
Right.
And what was your word again, Matt?
Confusion.
Perfect word for that.
No surprise. Those words are, an attempt to define what the speaker is going to talk about, what the speaker's ultimate message is going to be, and so we like to do that, and it really helps. It helps the audience understand what you're getting about, and the other is it helps you focus on, where your message is going to lie.
What I thought was amazing is how Bill tied all the words together at the end.
Yeah.
And actually had a very eloquent sentence there, which is nice.
He's great at that. He sits at this table a lot here in our studio, and he does weekly spensations, and we attach them to our OC-16 movies, and it's always pretty interesting. This week it's about Kaka'ako. No surprise there. Trying to catch the wave on that one. And we had Steve Roberts, real good guy from Hawaii Pacific Health. Did you know that Steve Roberts was a submariner, a nuclear submariner. That's how he got into nuclear
Really?
technology.
I did not know that.
And now he's, the technology guru at Hawaii Pacific Health. And of course, that's a perfect area to be in now in healthcare. It's all about technology. And I always say my personal favorite, no, present company excluded, of course. My personal favorite was Nadine Tensau. She's an incredible woman, and I'm not sure we coming from the same exact place, but I'll tell you why she's my favorite. She has a big heart, and she, and you hear her talk about medicine and caring about patients, and you know what sweeps over you? You want to be her patient. Unfortunately, she's a pediatrician. This doesn't help much. What did you think of her remarks, Matt?
Oh, she is so educated and so spot on with her remarks. And I think Queens is blessed to have her. I think she's chair of the pediatric group. And God, I know you don't see a pediatrician anymore, but kids are lucky to have her, for sure.
They are. She's a statement to all physicians. It's caduceus come live, It's a real caring there. And as I said in the panel, I thought that this program revealed a number of people, everybody on the panel and their organizations, who really cared about health in Hawaii, who really cared about their patients and about public health. And I thought that we have you're always looking for special distinction points between Hawaii and the rest of the world. Well, that's one of them. I think this place, and especially the health community, cares a lot about the health of everyone. That's a very nice thing to have. Anyway, thank you for participating in that panel. And
it was an honor.
Thank you for letting him participate.
Oh, no.
Tony and our whole team, make me look good, especially when it comes to healthcare. And as we talked about PPA-CA, I think it was Tom said, fasten your seatbelt and hang on for the ride. And
yeah.
It's going a million miles a minute, and we, as an HR company, try and stay up with it. And Tony's certified with PPA-CA, and it's
what is that?
It's a daunting task. Do you want to explain?
Well, sure. What it does is
Excuse me. Our viewing audience will understand. Yeah. Okay.
Sorry. Thank you. So the PPA-CA certification, what this does is give me a little bit more insight to the inner workings and details of what's going on with healthcare reform. As you know, there are about 15,000 pages of regulations for the PPA-CA alone, and it's changing every day. So just to keep track of what's going on and different things is why I got involved with that program itself.
Mm-hmm. So your title is Director of Benefits at Hawaii Group.
Yes, that's correct.
Well, that's great. Well, we have some pressing questions for you.
Oh, bring it on.
So, I also wanted to talk about the Hawaii Group, actually. The Hawaii Group, I've come to feel, is really a combination of a number of companies, Matt. What do you got going over there?
So we started with HIHR, the human resource company, and actually at the end of 2008, when tourism hit an all-time low, I was sitting around saying, what could I do in a downturning economy?
What was your background up to that point?
I'm a CPA, but my background was also in real estate and hotel management, hotel development. That's what brought me out to Hawaii in 1997. So at one point we had 22 resorts and 1,000 employees. And when I first started this new business, everybody said, he's a hotel guy. What does he know about HR? When you take a step back and you have 22 different properties and 1,000 employees, those are 22, in essence, different businesses, different cultures, different sets of employees, different payroll, different benefits, different handbooks, and really it was a miniature HR firm when you think about it. And there's a couple larger firms in town, great firms. One's Altris, two is Pro Service. There's a number of smaller companies, but really Hawaii, the demographic is 19 or fewer employees is roughly about 89% of all businesses.
Interesting.
And 90% of those have 9 or fewer. So if you take a step back and look at Hawaii's demographic in regards to small businesses, they're small. And most companies with 19 or fewer employees can't afford their own HR department, can't afford their own payroll, their own accounting, their own recruiting, staffing. So it really fit well, and we went down the path with HR. The next was staffing and recruiting. We have a company called HI Employment. Then logical was accounting, brought my CPA background into that, so HI accounting. We're now actually in healthcare. We have Hawaii Healthcare, which has two companies, Hawaii Home Care and Hawaii Nursing.
Is this providing health care?
Yeah, so we provide staff nurses to the hospitals on the nursing side and assisted
Like an employment
facilities.
service.
Yes, exactly. You know, because the main hospitals are all census driven. So they can't plan how many accidents or people are going to go to the ER or when their own staff gets sick or takes vacation. And then the home care business has medical and non-medical home care. So people that are medically fragile and need constant care in the home to people that just need home health aides. So those companies all really, again, are servicing Hawaii businesses. And with HIHR, and one of Tony's main roles is to try and stay in front of the PPACA so we can help not only our existing clients, 600 clients and over 7,000 employees, kind of navigate through, but we really want to be at the forefront because my word was confusion. It's confusing for us, and if it's confusing for us as HR people, you can imagine it's confusing for the 9 or 19 employee type company.
Well, it just strikes me that those businesses you're talking about, those mom and pop businesses, first, they are the backbone of the state. I mean, I would venture to say, you can agree or disagree, that the economy of the state is directly connected with the small businesses. If you had a lot of, if everything was run by big box stores and big hotels, it wouldn't be as healthy. The small businesses give the economy that, the health. And we can't afford to ignore them or marginalize them or oppress them or tax them out of existence or regulate them to death. We have got to support them. And the problem is that with these, confusing regulations, not only in healthcare but everything else, and with bureaucracy, the way it grows and grows and grows, it puts a burden on small businesses they didn't used to have. So if we want the economy to be healthy, then we want the small businesses to be healthy. And the way to make small businesses healthy is to support them just the way you are. So I think you found a niche, not only of value, on a profit basis for the company or the companies, but of value to that sector of the economy and therefore the economy in general. It's really perfect, Matt. Tony.
Absolutely. I think right timing for everything.
Yeah.
And our job is to support those small businesses so they can focus on their core business. You take an average roofer, they're very good at building roofs, fixing roofs, bidding on roofs, but do they want to take care of all the paperwork and the payroll and the occasional accident when somebody falls off the roof? Let other people come in and help with that and provide safety and risk management so they can go on to the next roof as an example. And so it's really a good niche, and especially with the economy, it is turning around, but everybody's always trying to improve their bottom line, and HR is just a very critical component. And to support, the companies still need to develop their own culture, their own morale, their own vision, mission, but really if we can help support them, it helps them thrive in the economy at the same time.
Yeah, and if they don't know about the details of these things, the confusing details, if you will, and they spend, too much time trying to learn those things and become expert at stuff that, they don't use very much, they're wasting time and therefore money.
Sure.
And you can do that at a much better, cost essentially, in time and money than they can.
Yes, and we'll get into some of these questions, talk about what is a small business and how do you qualify, et cetera. But that's another main reason why HR firms are doing very well now, because we're actually considered, a community rated or a large employer because we are buying for all of these thousands of employees. So your typical 10 employee business is in essence getting penalized from a purchasing power standpoint. So that's another reason why so many people come to us, is there's quite a big difference usually between what they can buy, all insurances from workers' comp to health to TDI, than what they can get it through us. Not every time, but most of the time. So it generates a pretty hefty savings, which then justifies paying for the fee, and they're getting a service on top of it. And the other main reason is compliance, and we'll talk about compliance. The PPACA is just another layer of compliance that everybody's going to have to do, and there's going to be real penalties, and all the way down to your tax return form of showing that you complied, which currently you don't have to do.
Speaking of compliance, we got to comply and take a break now.
All right.
Okay, That's Matt Delaney, and we got Tony Malone, both from the Hawaii group. And here we're talking about healthcare in Hawaii, and we're referring back to the show we did at the Plaza Club on June 27th. We'll be right back after this break. Thanks. Okay, we're back. We're live. We're ThinkTech. It's Monday, actually. And this is Healthcare in Hawaii with Matt Delaney and Tony Malone of the Hawaii Group. And we're talking about the Healthcare in Hawaii program that we did on June 27th, what we learned from it and what we didn't learn from it, because we had lots of questions. We take questions by index cards from the attendees, lots of questions that weren't answered. So I gave you guys the questions, and you selected some you'd like to address. So let's get at it. Matt, what are the questions that appeal to you, and what are your answers?
All right, let me start out with one of these. Question is, will employers who hire only or mostly part-time workers face penalties under the ACA? So take a little step back. You know, if you're in Middle America and it's not a competitive working environment, and you don't provide health care benefits currently to your employees, the Affordable Care Act is a very, very big deal. You know, now you're being forced to, as an employer and as an individual, to get health care coverage, mandated, but you now have to provide health care for your employees if you're 50 or more, and if they work 30 hours or more. So if we take a step back to, I think, 1974, we have the Prepaid Health Care Act. And whether you like it or not, it's in our world, it's customary, everybody knows it's here, it's not a deterrent anymore. And the people that were involved way back were really on the forefront, and really Obamacare is not even as rich as prepaid healthcare. But to answer this question, so the prepaid healthcare, I think most people know, but it is a requirement for any Hawaii business that has one employee that works 20 hours or more for 4 consecutive weeks, and then you have to provide health care on the first of the following month. So from the requirement, the threshold, the barrier to provide it, we have prepaid health care. So we already have to do it for one employee in 20 hours, not 50 employees in 30 hours. And by the way, you don't have to provide health care until day 91 under the Affordable Care Act. So people in Hawaii that are already potentially trying to avoid providing health care, they potentially already are having work weeks of 19 or fewer. And there's nothing illegal about that. If you start fudging the numbers, then of course that's not really an ethical thing to do. But a lot of retail establishments, they have part-time employees because they don't want to. So in general, across the country, one of the recent announcements, one of the largest movie theaters across the whole country has already told their entire staff that their work week is going to be 29 hours a week, period, because they don't want to provide health care. So that's, do you want to take one, Tony?
Sure.
Yeah. Just to go to that question, though, the thing with the 29 hours and the chain of movie houses just strikes me as a way for them to undermine the whole idea and it's not a good thing for the country. I don't know how you fix that. It's the way it works, but in terms of how they care about their employees, it doesn't demonstrate a lot of care about their employees.
And I think if you fast forward, I think at some point, Obamacare is going to look very much like prepaid healthcare and reduce the requirements to 20 hours to one. Because if you're really trying to provide healthcare, there's a big difference between 50 and one employee. So if the goal is to provide healthcare, then you do it. And I guess I didn't answer the penalty portion. There is a penalty portion. President Obama has delayed the employer mandate for 1 year.
Yeah.
There's still the individual mandate, so everybody has to have coverage. But again, for Hawaii, it doesn't change anything because we have prepaid healthcare. But once the employer portion is law on the federal level, and you're on the mainland, let's say, and you're not complying, there is a penalty. Currently, the penalty is very low. It's about $167 a month. So some employers are going to just pay the $167 a month per employee.
That's a lot cheaper than the healthcare insurance,
especially in other parts of the country. So it'll be interesting how that plays out. But again, it's just last week was announced it's going to be deferred for 1 year.
It's a good idea to defer it. It minimizes the confusion and intimidation factor of the ACA. Okay, let's go to question number 2. Door number 2, Tony.
Okay, door number 2.
This one's yours.
How will people without a computer be able to sign up or access health care? If you don't have a computer, there's still going to be a lot of different ways to access health care. You can go directly to the Health Connector. The Health Connector also will have in-person assisters as well as navigators that can assist. You can go directly to carriers, the insurance carriers. Many of the carriers are planning to set up retail shops, so you can visit them, sign up for your health care. There may be even a time when you go to the hospital, you don't have insurance, and there's somebody at the hospital helping you at the time to get you covered for insurance. So there's going to be a lot of different avenues. You can go through your employers if you're employed to get your health insurance. If you're eligible, you can go through PEO companies such as Hawaii HR.
By the changes involved, and we talk about changes, this is all about change. In fact, I had lunch with my partner today, Ed Bendet, and we talked about how everything is changing at a more rapid rate than it ever did. When we got out of law school, we said, why are they changing the laws all the time? They made us study it, they made us learn it. Now, as soon as you get out of law school, everything changes. Well, that's the way it is, and it changes faster, logarithmically. So all these changes, who's going to be suffering more? And what is your advice? Where is the best place for me to get, connected with healthcare in Hawaii going forward?
Well, going forward, if you're, like Matt mentioned earlier, most of the businesses here are smaller businesses and don't really have the time to research, to keep up with all this information. So companies like ours, Hawaii HR, who can offer you the expertise and kind of guidance. We're always here to help smaller companies. You can also go to your current insurance carriers directly, ask them for advice, ask them, because they are advocating for you as well.
Yeah, but you know what? It strikes me, if I had to guess, you can agree or disagree, that an HR company would probably be my best bet, because you have no agenda except to help me. That's it.
100% agree with you.
Yeah, that actually leads into this question, Jay. How will small businesses access coverage? And as Tony mentioned, the nice thing is the way you access your healthcare now is not going to change. You can go direct to the carrier. You can use your insurance agent. You can go to an HR firm such as ours, or as another one. And now there's going to be the addition, a fourth avenue, is the Hawaii Health Connector. It's supposed to be up by October 1st. And that's really the online Amazon type shopping center where you're going to be able to go online and search, compare different plans. And if you don't have healthcare, you're going to be able to buy it right there. And everything's going to go through the system. So there's actually going to be a new fourth mechanism. So even easier is the goal to have every individual be able to get healthcare.
Matt, can you give me some timeline here? I mean, both programs we did, I think people were wondering when. We are all worried and confused about what's going to happen to us, but when is this going to happen to us? What's it going to look like down the road?
Yeah, well, again, to benefit the employer, that piece is being delayed a year, which is nice.
Okay.
You know, they think, I've seen different stats, but between 80 and 100,000 are uninsured in Hawaii, which is relatively low compared to 6 million in California. So those are most likely the people that are going to go to the connector. You know, if you're employed and work 20 hours, you have health care, which is a nice thing. So it's October 1st is when it's going to roll out for an effective date of January 1st. So between October 1st and December 31st is this window where you can go buy insurance that will kick in on January 1st.
Okay. Doesn't necessarily have to kick in October 1st and November 1st and so on.
Right.
But it has to kick in by January 1st.
Yes.
Okay.
And there are different windows. You know, initially in the first drafts that came out, you could theoretically, I think, go to the ER mid-year and get insurance right there, which clearly would have a negative effect because the only people that are going to go get it are the people that need it when they need it. Now they're fixing the window of opportunity, so more of a true open enrollment period. Just like when you're working for a company, you can sign up for medical once you're eligible, but you just can't change every given month and add a spouse or add family. It has to be done once a year unless there's a major event that takes place. So with that, there's a question right here which kind of leads to what are the new reporting requirements for employers? Mm-hmm. And this is, again, another reason, and also suggest you talk to your attorneys. Attorneys are very well versed in this.
Oh, yeah?
Your benefit companies.
I hope so.
And so one thing that every employer should know is on October 1st or before of this year, you need to submit a notice to every single one of your employees explaining and educating them on the healthcare exchange, and ours in Hawaii is called the Hawaii Health Connector. And again, I guess if I'm an employee, I'm going to get confused because, wait, I already have insurance, but it's one of the reporting requirements, so hopefully people will write them in a good manner that doesn't confuse people even more. In 2014, if you're not already doing it, you need to report the benefits on the employee's W-2. So that's going to be a new requirement. Some people are already doing it in anticipation, but that's a new requirement. And then in 2015, every employee's monthly status, hours, cost of benefits, that all needs to be reported too. So the reporting requirements just keep getting more and more and more. So again, we've had prepaid healthcare, we've been doing it, but from my experience, there's really not a police making sure that the prepaid healthcare is enacted. Of course, if an employee blows a whistle or goes to the Department of Labor and says, my employer's not giving me coverage, then of course they go investigate and research, but they don't have the manpower, the resources to be policing, you know, a couple 100,000 employees in the state. So these are new federal requirements. So again, you're going to have to prove that you're doing them. Again, another reason to really consult with your agency, with your carrier, with an HR company, with your attorney, because these are strict compliance requirements that are going to be part of the deal.
Two thoughts come to mind. You know, one of them, of course, is that as we get into a new statute, which, you know, was born by fits and starts, if you will, and still involved in fits and starts. You know, we don't know exactly how it would be implemented. I mean, in other words, that it will be implemented strictly by its terms. And that we say compliance, will they really require compliance? When they say that this is supposed to happen, will it really happen? And I think, you know, with the complexity of this, how many pages is it?
15,000.
15,000.
Yeah, regulations, statute itself is 1,000 pages. I mean, really. I mean, they laugh at us in Europe you know, when we tell them we have this complexity. But it seems to me that this is going to be polished or amended. Parts of it are going to be taken very seriously. Other parts are going to be, you know, left behind. So it was still carving the statute out of the marble. and you guys are, you know, close to that. You'll see it happening. But just because it's in the statute doesn't mean it's going to become the culture of healthcare in Hawaii or the United States. The other thing I wanted to ask you before we go too far is, assuming that I have nobody to help me, and I wanted to read up on this, where would I go?
I think there's a couple different great websites. One is the kaiserhealthfoundation.org. Tremendous amount of information on the PPACA in general. If you go to HMSA's website, they have a whole tab that explains it. And there's a couple, I don't know the URLs right now, but on the state website, on the Hawaii.gov site, that kind of explain in big picture how this is unfolding. But they're great resources.
Great.
We'd be happy to provide them to you so you can give them to your listeners and
Okay,
readers.
yes, thank you for that. That's the voice of Matt Delaney, and with him is Tony Malone. They are the principals, may I say that, of the Hawaii Group, which is an HR firm with many, many functions in Hawaii. We're talking about healthcare in Hawaii today, and we're tripping off the program that ThinkTech and the Venture Capital Association did on June 27th at the Plaza Club. And we'll get back to more questions that were asked but not yet answered at that program right after this break. Thank you, gentlemen. We're back, we're live, we're ThinkTech. Here it is Monday, the 8th. Did I get that? No, Tuesday, the 9th. Thank you very much.
Feels like
July.
Monday.
And we're here talking about healthcare in Hawaii with Matt Delaney and Tony Malone of the Hawaii Group, an HR firm, among other things. And we've talked about who was on the program on June 27th, where this all started. We talked about the nature of an HR group and how they can be valuable in dealing with the confusion, if I may. And now we're answering Q&A that was submitted but never answered at the program. So you're up next, Tony. What question do you like to answer?
Sure. How does this affect rates for employers who already have health insurance? Well, as we already seen for the past few years, health premiums have been increasing. It's always going to increase, and the whole point of this is to bend the cost curve. As we've seen, you will already see a 2% increase in your rates just because of the ACA itself, an additional tax of 2%.
I have seen healthcare rates go from the time I started practicing law from about 50 or 60 bucks per capita in a given firm to what it is now, which is 10 times that and more.
And it's going to continue.
2% on top of that? Boy.
Along with medical inflation and whatever is chosen, yes. So we are going to see increases across the board.
Okay, well, we'll get over it. It's just the reality.
It's reality. It's here to stay. As you've seen, they've tried to repeal it on numerous occasions, but we're just moving forward.
I don't think repeal is going to help, or be possible for that matter. Anyway, okay, next question.
My next question: how is a small business determined? Again, for the ACA, it's 50 employees or more. For Hawaii prepaid healthcare, it's 1 employee. There's some other regulations, and they're still being worked on, that are 100 employees and above, different requirements. But again, from Hawaii's standpoint, compliance with the ACA is 50, but prepaid still exists. There's a lot of still work going on at the state with the attorneys of, again, how do these two really bridge and get married together, because prepaid healthcare has a much lower threshold of requirements, you know, with one employee working 20 hours or more for 4 consecutive weeks. So from a healthcare standpoint, ACA is 50 employees. Hawaii prepaid is just 1.
Yeah. Interesting that we're so much better off. We've been so much better off here. So all we got to do is keep on doing what we were doing before. We'll be okay. If you comply with the Prepaid Healthcare Act, you've automatically complied, right, with the ACA. At least in those parameters.
I think we're very fortunate in Hawaii, until you leave Hawaii, realizing how good our healthcare really is here, with some major players. You know, I think neighbor islands have a little more challenges because they're a little more rural, but we have Queens Health Systems, HPH, Kaiser, just 3 amazing institutions here. And of course, they all have their own clinics, private practices, and we're on an island, so it's not like you have to drive across the state to go see a specialist. It's right here in our backyard. So we are fortunate to have great healthcare here.
Well, at first we thought it was housing. As housing goes, so goes the state. And this is off that General Motors thing years ago. And then we thought, well, it was Kaka'ako. As Kaka'ako goes, so goes the state. Now it's healthcare. As healthcare goes, so goes the state. You can't have an effective economy or a happy population who's sick.
Right.
They have to feel they've got, that you're in somebody's hands protected. Anyway, next question. Tony, yours.
Sure, I have my last question here. We heard rates can be based on age. What about gender? For the ACA moving forward, it will all be based on age and smoking, but not gender. So
Well, that sounds constitutional.
equal opportunity.
So really with that now, a typical small business, 5, 10 employees, if they go direct to a carrier, HMSA for example, they are in a community rated program with all other small businesses, and the rate is X. It doesn't matter if you're 20, it doesn't matter if you're 60, male, female, if you're that small group. So what could happen going forward, potentially, is the 20-year-olds potentially could have a lower rate, and the 60-year-olds could theoretically have a higher rate, because it's only going to be looked upon their age, and again, the smoking. Pre-existing conditions are out, all of that. So it's literally healthy 60-year-old, unhealthy 60-year-old. If they both apply at the same time, they theoretically are going to get the same rate. So
what's the net effect of all of that?
it's going to be really interesting. I think that's part of what the unknown for all of us is how are these costs going to impact the overall system? Because again, we have 80,000, 100,000 uninsured right now in Hawaii. Because of prepaid, almost everybody has health care, or your spouse has it, so you get it through them. So it's a when you really look at the team that's building the Hawaii Health Connector, Coral and Kevin and Rose, doing a fabulous job. They're so ahead of the curve regarding the rest of the country.
Great.
I think they're like number 1 or 2 in regards to their pace and timing. But we're building virtually the same type of system that a California has, with 6 million uninsured that are going to rush to the exchange. So it's going to be really interesting to see how many people really go to the exchange. One of these questions here, and is one reason to go there, is tax credits and subsidies. Currently, and for all the viewers and small businesses, through 2013, the end of this year, a small business that has 0 to 25 full-time equivalents, that's the scale on both ends, and they make between $0 and $50,000 average, is a 0 to 35% medical premium tax credit. Right on your tax return, your company it then flows through. It depends what type of company. But you'll get a tax credit. And again, the higher the wage and the higher the employees, the lower the credit becomes. But effective January 1st, 2014, that credit is only going to be able to be obtained if you go through the connector. So that small business, if they are eligible, that might be a driving factor to push them towards the exchange, because now they'll get it. And then the individual can potentially get a subsidy if they're below the average income, and they can help get their premiums subsidized. So that's what will drive people to the exchange. It's not up and running, so none of us know, what's really on there. To date, I believe HMSA and Kaiser are the only two players on our local exchange here. It's not to say others won't enter it in the future.
What is the exchange? It sounds like a market of some kind.
Yeah, so it's an online shopping market in which they will have assisters and navigators that will help walk you through and explain the different plans. But theoretically, you're going to go online and look at an HMSA plan, a Kaiser plan, different plans. They have different labels, silver, gold,
So you design the
right.
plan that's right for your company right there on the exchange, on the web.
Yeah, so first the insurance carriers put plans on there that meet the eligibility and the service requirements of the ACA. Then yes, if you were the employer, you can go on and you can kind of pick and choose and model a plan, and then your employees can go on and pick what they want. So directly they might have more options than if more people join the exchange in the future, carriers. Right now, Kaiser generally will coexist with an HMSA, UHA, or HMAA. So it's nice. Your employees can have both options. Usually it's larger employers that offer two plans. But HMSA won't coexist with HMAA or UHA currently directly.
That's their business decision.
Yes. So theoretically in the future, if there are more participants, carriers on the connector, you theoretically could pick and choose, and one employee could pick Kaiser, one could pick
The same
HMSA,
company. One employee, the same company.
Yes, but right now, at least what we've been told is just HMSA and Kaiser, the two players on there.
Well, if it works, there'll be more, I think. But it's very interesting that it allows the employer the freedom of making choices right there, and it allows the employees the freedom of making choices right there. I mean, this is what computers are all about. This is the integration of information technology into the marketplace of health insurance, and it really it brings it to the people, I think. We had lots of information technology and insurance up to this point, but this is different because it brings it right to your doorstep. That's different. Anyway, okay, more questions?
Yeah, there's another one on the connector. It says, after the federal funds run dry, where will funding come from? The goal for the Hawaii Health Connector is to be self-sustaining once it's up and running. So what does that mean? We don't know yet. Is the connector at some point can be charging a fee, or like a broker? They will most likely offer other things that they will be able to earn commissions. Maybe it's other lines of insurance. Maybe it's pet insurance. Maybe it's life insurance.
That they
other
have
things,
to make
but
themselves
it's
relevant
supposed to be
enough so that people will be willing to use them
Yes.
and pay that charge.
Yes. So it needs to be self-sufficient, which is, I think, a big question for everybody. How is this thing going to be self-sufficient? Is there going to be enough volume to drive through there to be self-sufficient? Because there's always going to need to be staff basically running it. I mean, it's technology,
Sure.
but you still need a team.
But the connector in Hawaii is not going to have economies of scale because it only handles the people who might not otherwise be insured, right?
Right. And so currently it's federally funded to get it totally up and running. The portal, in essence, the online shopping, and the call center. There will be a call center that real people will pick up the phone and walk you through it. And that is all being federally funded. And big number. So once that money does run dry, then it needs to be self-sustaining.
You remember my word for the program? It was change. And I feel it again and again,
Yes.
washing over me.
Rapidly. How will a family be covered i.e., does the family have a right to go through the exchange? Yes, so if an individual goes to the exchange, they can then purchase dependent coverage for their children or their spouse or their entire family. Most employers offer that to their employees currently. They make their employee pay for it. There's still some very generous employers out there that actually pay for entire family, but it's very expensive, you know, between $1,000 and $2,000 per month. But that ability will always be there for the family to get coverage through the individual, either the employee or the individual going through the connector.
That's good to have that another choice. We're going to take a short break. That's Matt Delaney and Tony Malone of the Hawaii Group. We're talking about healthcare in Hawaii. We're reminiscing about our good times on June 27th when we had a program by the same name at the Plaza Club. We'll be right back after this break. Okay, we're back. We're live. We're at ThinkTech. We're here with Matt Delaney, Tony Malone of the Hawaii Group on healthcare in Hawaii. And now we're going to dedicate this part of our discussion to how various elements of our business community, our government community, our community in general will be affected as we see it now, because it's changing and we can't anticipate everything. But what do you think? What do you think about the changes to come? I'll break it down. and there's probably stuff we'll miss here, but government. How is this going to affect government? How is it going to change government? Matt?
That's a tough question. I think we need Tom Matsuda for that. Yeah. You know, it's one more layer now of reporting requirements, new laws, very confusing, very complex. The goal of the ACA was, right, Hawaii doesn't have as big of a problem. We have 80,000, give or take, uninsured. Across the country, there's millions and millions and millions of people that don't have access to health care. So we're a little isolated. We're ahead of our times with prepaid health care. But the goal, when you think about it, is to give everybody access to health care. Now, making it mandatory is the next step, right? That's, as of January 1st, 2014, an individual mandate that everybody's going to have to prove that they have it. Now, there's a fine if you don't. And again, some young people might feel they're, perfectly fine without health care, and they'll pay the fine until the time they get really sick or get in an accident and realize it. But there are some really good things about it that the government's trying to do. And, one is really about trying to be healthier and preventative care and getting things fixed before they become bigger issues. The chronic disease and chronic illnesses take up such a big piece of the cost than the healthy people, and then we all end up paying for it. So there's a lot of great things of really trying to make people healthier, and again, Hilton toward as well. The more well we all can be, On the insurance side, it's reimbursing for quality. It's not going to be, again, how much you do anymore. It's how well did you do? Is the outcome the right outcome? If they come back to the hospital because they have an infection, or they keep slipping and falling out of the bed, those things are not going to be reimbursed going forward. It's quality healthcare, which I think those things are really good, and the health systems across the country have been pushing for that for years now, of reimbursement for quality versus quantity.
Yeah, well, and it forces accountability. I think that was Nadine Tensal talked about that, but also Ginny Pressler talked about it, and Hilton Rathel talked about it too. As you become accountable for your own health, you got to take responsibility. You can't expect everybody to be in loco parentis and help you at all points of the process. The journey is essentially your journey, and I think that's actually a worthy mission. It's a worthy point or concept in the law. So what about those employers? Say the big box employers. Say the ones like the ones in the South. Say the ones across the country in the movie chain you talked about. Everybody drops their numbers below, so they don't qualify. They don't have to comply with anything. This is going to change American labor, isn't it?
Potentially.
Yeah.
Yet the states that are all moving forward with their exchanges now, because of the individual mandate, that movie theater, for example, that as the employer is not providing, now that individual has the ability to go to their own state exchange and buy insurance, which currently in a lot of states they don't even have access, right, if they don't have coverage. So it is going to change. It is going to change the way people staff. How many years forward do we fast forward when they start closing these loopholes, to making it any employee that works 1 hour has to get health care at some point. But the point of the exchanges is so everybody has access. So now those big boxes that decide and make the conscious decision, we're not going to give health care to our employees because it's a huge cost, especially to minimum wage workers. I mean, health care could be more than their paycheck. The exchange is kind of that option for them to go purchase it.
Makes you think that the ACA is really step one. It's the first shoe dropping, but there'll be another shoe in 5 or 6 years when we sort of explore the experience. So, Tony, what about the effect on the professional community? What about the effect on the HR companies? What about the effect on the lawyers, the accountants, the insurance brokers who make a living, out of trying to help people through this thicket? What effect is it going to have on that industry, so to speak?
Well, if we start with the HR professionals, see they were already tasked with multiple tasks. They're having to wear multiple hats. Moving forward, I can only see them having that one more hat that they're going to have to wear in order to stay up with the ACA, all the compliance, the reporting, all the changes that are happening.
So you recommend somebody go into this business, or maybe they should get away from it, huh?
Well, it might be a good time to join in, right?
Join in, okay,
Yeah.
got that. Well, take it a step further. I mean, what's going to happen to the, and this is the big question, to the healthcare delivery system? That is the hospitals, the doctors, all the people who earn their living providing health. How is life going to change for them?
I think there's a big shift towards accountable care organizations. You take Kaiser's an incredible model, and it works where there's a lot of population. It's very big in California. It's very big here, right? You show up to Kaiser, and there's a team there that not only takes care of you, but all of your records are there. Everything from your tests to your different doctors. And I think there's going to be more of a shift of the care being delivered that way versus you always going on your own if you have a PPO plan and start going to all your specialists on your own. So I see, and I've heard Ginny talk about it, I've heard Art Ishijima Queens talk about, kind of shifting more towards a lot of those medical services being done within the hospital versus, private practices. I think there's a lot of private practice forming their own groups to provide those services. So now you'll go to the hospital and everything will be there. I think there'll be a shift of more work kind of being pushed down the ladder because doctors' times are so valuable. A lot more PAs, physician assistants, registered nurses, nurse practitioners that are taking care of the more day-to-day things and having the doctors really focus on the very critical needs. So I think there's going to be a shift there. And in Hawaii, I mean, the shortage of doctors is already here, especially on the neighbor islands. So what can we do to recruit more doctors? And it's paradise here, so everybody wants to come here, but the cost of living is high. The bureaucracy is tough. Obamacare is now entering into the world for everybody else, but we have prepaid healthcare. It's very expensive to do business here versus other states.
That's the bottom line. That's the most important thing. We have to manage this in such a way, again, as we said in the first place, so we don't put an oppressive burden on small business. Well, thank you very much, Matt. That's Matt Delaney, Tony Malone from the Hawaii Group. Thank you very much for helping us discuss and understand and be less confused about healthcare in Hawaii. We're gonna take a little break now, and we're gonna go to our next show, which involves the foreign policy considerations of drones in Hawaii. We'll be right back. Stay there for the next 4 or 5 minutes, and you'll see that too.